Okay, you're still having the same fitness level. So bila dia dah habis recovery period and after all the intensive exercise and stuff like that, bila dah sampai race day, dia dah boleh straight away, perform good in their race. So this is my goal for my clients. Bila you ada sakit, you analyze your pain because pain, like the doctor said, it could be a lot of factors. Some people, dia punya pain kadang-kadang dekat sini je because they have been having the pain for a long time. So dia punya brain dah interpret pain as the main thing that they are focusing. Okay, so our job is actually to divert them and tell them that pain is not everything. Okay, so even if they have some soreness, okay, fine, they have soreness. We will do physio on you. Lepas tu, you try to set your baseline. Macam saya cakap tadi, kalau 5 km sakit, kalau dia run for maybe pace 6, pace 7, 5 km dia sakit, okay, never mind. You run for 4 km and run at a lower speed. So you see, win-win situation. Kita punya physio tengah bantu dia and at the same time, dia punya fitness level is still good. So I think the current myth is whether should I rest or should I push. Tetapi kalau dia cakap dia punya pain is 6, 7, okay, that means it's more than 4 over 10. We will ask them to, just reduce activity level, okay, while waiting for the pain to subside. And then kalau dia rasa 5 over 10 or 6 over 10, lepas 24 hours, then maybe tissue damage is done. So you will ask them, okay, we don't really push ourselves. Tapi kalau dia rasa 2 over 10 and dia punya pain tak sampai 2 jam pun, then we will see that, okay, your pain level is actually not that intensive. You can still do the exercises yang I bagi and at the same time we can, do whatever activities you are doing. So you see, win-win situation. Performance dia okay, kita pun happy. Okay, so I think this is the current myth lah, whether you should rest or not.
Okay, thank you, Ms. Cindy. So, how about you, Dr. So, do you have any myth for exercise that you want to share with us?
What? Come again?
Do you have any myth about exercises that you have heard that you want to share with us?
What do you mean myth exercise?
Myth
okay.
yes.
Right. What's exercises? Okay. For example, they say when exercises, I need to sweat a lot. Okay. Do I need to sweat a lot when I do exercises? Actually, it's not necessary to sweat a lot. Okay, but when we do exercises, yes, definitely our body will be sweat lah. Okay, because to reduce the core temperature. Okay, especially if you do exercises in a hot environment, definitely you will sweat a lot. But it doesn't mean that if you sweat a lot, meaning that the exercise is effective. You have burned a lot of fat. You have burned a lot of calories. No, it doesn't mean that. It's just that when you do exercises, you sweat. It is because of to reduce the core temperature, to prevent your body temperature from rising.
All right. Thank you, Ms. Cindy and Dr. Sawana. So regarding our second topic, we have received a few questions from the participants. So for the first question is for Ms. Cindy. Should I warm up before doing Zumba? So what do you think about this question?
Yes, if you warm up as in macam, because when you're warming up, you are actually improving the blood flow to your muscles. So when your muscles are warm up, it is smarter for you to do any activities. Because if you don't warm up before your Zumba, you don't really have the muscle memory of doing those stuff. And then that is when your cramp will come. Okay, and then you might also have some sprain and strain along the way because your muscles are not ready for it. So I think, yes, you should do even a slight warm up before Zumba, because Zumba activities is mainly maybe going forward, backward with some twisting and turning, right? Zumba. So before the activities, we should just maybe do a bit of slow turning, slow moving side by side, like that, just to get yourself ready for Zumba. And then what I'm talking about, all this warm up is actually to do dynamic warm up. Okay, so we have two types of warm up, which is static warm up and also dynamic warm up. For static warm up is basic stretching. Okay, there is no wrong and right. Okay, so static warm up is all the stretchings, hamstring stretching, calf stretching. Why I say that I prefer to do dynamic warm up is we have to always look at the activities they are doing. Okay, for example, you buat activity Zumba, a lot of moving, right? So you punya warm up must be practical for your Zumba. like for example, if you do Zumba, you cannot be just only stretching. Okay, you should also move around just to get your muscles bijak sebelum you perform all those Zumba. This is my opinion on whether you should do it or not.
Okay, thank you, Miss Cindy. So we move to our next question for Dr. Sawana. So how effective is Salonpas tape in reducing pain after DOMS or in the use of back pain? Or is it considered as a heat therapy? What do you think, Dr. Sawana?
DOMS, right?
Yes.
Alright, DOMS, or delayed onset muscle soreness, is a pain and stiffness over the muscles. And usually it begins after exercises, no? Right? 24 hours to 84 hours. Okay. It occurred due to micro trauma. Okay. Actually, when we have DOMS after exercises, it tells us that the exercise that we do is too challenging or too long or too intense. Okay. So in physiotherapy practice, we didn't use Stallone pass tap. Okay. Stallone pass tape, to reduce DOMS. Okay. We treat DOMS. Normally we treat DOMS with ice. What else? Gentle stretching and some free active exercises. And usually DOMS will go away around 4 to 5 days. Okay. So if you ask me about the effectiveness of Ceylon pass tape, to be honest, I couldn't find any paper shows that Ceylon pass tape is effective in reducing pain or reducing DOMS. Okay, and because of I never use that tape, so I cannot, I cannot tell you whether the heat produced by the tape is safe or effective. Okay, and I'm not sure whether the heat is I mean the tape do not cause irritation. The heat do not cause irritation to the skin. Okay, I'm not so sure about that. Okay, again maybe other people or other experts from the pharmacology fields have better explanation about this tape because when we read at the packaging, kan, it said that it is topical pain reliever, if not mistaken. Yeah. So maybe they have or maybe they use special ingredients that produce the heat. Okay, so from the physiotherapy perspective, we didn't use the tapes to reduce pain or to reduce DOMS.
Okay, I see. Thank you, Dr. Sawana. So Miss Cindy, what your thought about this question? Did you usually see the athlete use a salon tape or not?
Mm, I think athletes they kind of use like I said because it is since last time people been using. So I think for all these things, right? Because some patches, because just now we were talking about minyak angin kan,
Mm-hmm.
this is the patch types. So if you see a lot of doctors, they actually prescribe AccuStop. Have you seen AccuStop before? AccuStop to reduce back pain. But one thing about AccuStop is they actually they actually contain NSAIDs. That means some ibuprofen and some medicated patches. So those stuff actually it is medicated and sort of reduce it actually relieves the pain, not reduce. Because when you have all this cooling effect, when you have all this medicated thing, it is actually to let your brain know that, oh, there are another sensation. So my brain will focus on the cooling effect rather than the pain. So it is not like a main treatment for pain reduce. It is just something that deviate you to focus on the cooling effect rather than the pain. So this is just very temporary and it is not like the main management for pain relief. So it is better for you to go for heat therapy, which is it's deeper because heat therapy they actually increase the local soft tissue temperature by a few cm deeper. So I think using heat therapy is much better than all these patches.
All right. Thank you, Miss Cindy. So, actually, DOMS, we can like DOMS is a delay onset muscle, right? So actually, can we proceed with exercises after we have a DOMS or not?
Think
What do
light
you
intensity exercises should be good because when you have domes, you're actually having a lot of pain, okay, a lot of tightness, pain. So by just resting and not doing anything, you will actually the thing is still there. So what you do is you have some light intensity walking. Okay, walking just get your muscles a bit flexible. I think that is going to help to reduce DOMS effect a lot. And then maybe you can put on heat therapy. You can do some very light stretching or very light massages. I think that is also very good for DOMS because you cannot be putting all the tape around your body for DOMS, right? Because the DOMS is actually affecting the entire body. So I think do some light walking and just relax yourself is good. Do some maybe some different activities such as swimming. If you get DOMS by running, you can do some swimming. Just relax yourself. It's the best recovery really.
Alright. Thank you, Miss Cindy. So we move to our next question. So myth or facts, in order to have a bulky body, you need to eat more protein besides doing exercises. So what do you think, Miss Cindy?
Myth or fact lah. It is actually fact because to increase your body because whenever you do exercises our muscle cells will actually have some micro tear which is normal micro tear that they are waiting for the nutrients that you have to actually build a bigger muscle. So protein actually rejuvenate those muscles and repair muscle cells. So when they are repairing, after they repair, they will actually have a larger and bulkier body. So I think other than protein, other than makan, you also have to focus on your exercises, which is what kind of exercises you are doing. Like I said, the goal, whether to build a bulky body or you're going to reduce weight. If you're going to build a bulky body, you have to actually focus on those weight but increase sets and reps of the exercises macam buat more sets or more repetitions of exercises, and also you have to focus on a lot of eccentric training. That means eccentric dia macam going towards the gravity, you have to really hold it and focus on eccentric activities. So I think the fact is yes you need, but the myth is not only that, you have to include a lot of things to have a good body physique. This is my opinion.
All right. Thank you, Miss Cindy. So we move to our next question. For Dr. Sawana, can exercise really improve sleep quality? What do you think?
Okay, exercise and sleep quality. Okay. There are many experimental studies shows that exercise improve the sleep quality. Okay. So evidence says that moderate intensity exercises 3 times in a week significantly improve sleep outcomes. Okay. So it has been proposed that regular exercise in daytime will increase melatonin hormone, and this hormone, melatonin hormone, is a sleep hormone. Okay, so this hormone will prepare our body to sleep. That's why when you exercise, this hormone increase, and you might not have sleep problems anymore. Okay, but the expert says that do not exercise 2 hours before sleep because other than when you exercise, you also increase endorphin during exercise. Also, endorphin, the body will release endorphin, and the other thing is serotonin. And these two hormones will make us more alert.
Okay, I see. Thank you, Dr. Sawana. So, next question is for Miss Cindy. So, is it true that drinking ice water will lower down our momentum, and that is why athletes who have tournaments are prevented from taking any ice water? What do you think? What happened actually when you drink cold water often after or during exercises, and how does it affect your body?
Okay, actually, when you drink cold water, you're actually bringing down your core temperature lower. So it is actually to prevent overheating ataupun heat stroke. Okay, so when you're doing exercises, of course, we are not talking about freezing cold water. It's just maybe slightly iced water just to bring down your temperature. You can tahan lama dia. Because if you have a very high body temperature, what you do is you tend to be very tired. That is when your stamina will gone down and you cannot go longer for your activities. So I think drinking ice water in a moderate speed, you're not talking about like a lot. I think it's going to bring down your temperature and make you feel you can tahan lama in some exercises. And like after exercises, they actually said that you cannot really drink it fast because what happens is it's going to affect your digestive system and your stomach is going to have a lot of cramps. Because you drink fast, it's going to have shock in your organs and you will really have a lot of cramps. So I think we are talking about moderation now. You pun tak boleh keep drinking hot water, correct? Not because it will bring up your temperature. So I think we are talking about moderation where you don't drink so fast and you don't drink a lot. I think regarding about people who have tournaments are prevented from taking ice water. This is in my opinion, I've never encountered before this issue. Maybe I will ask some expert about this.
Okay, thank you, Miss Lee. So, is it okay for us, right after we do an exercises, of course, we will feel exhausted. So, is it okay for us to drink a cool water right after we do exercises, or in the meantime of we doing the exercises?
I think whenever you feel thirsty, okay, whenever you feel thirsty, it is okay for you to drink water. Like I said, don't drink it fast because it's going to cause stomach cramp. So when you are doing your exercises, you feel like you should take water, please go and take because it's going to improve your hydration. When you go dehydrated, what happens is you get very tired. So your exercises won't be good. And after you do your exercises, yes, you can drink some ice water, but in a very low speed. You cannot straight away drink fast because all your muscles are tired. You see, after your exercises, your muscles are tired. So they are in a very vulnerable position where if you drink fast, they're going to have shock. And that is when vessel constriction, like I mentioned just now, vessel constriction is going to happen and your stomach is going to have a lot of cramps in digestive point of view. So I think the speed does matter. No matter what kind of drink that you drink, the speed does matter.
I see. Okay, thank you, Miss Indy. So, actually, when we drink cold water, just the duration of we drinking the water is matters, right?
I think I mean you don't keep drinking very fast because
Very fast. Okay.
you're gonna
I
have
see.
cramps here and there.
So, okay, we will move to next question for Dr. Sawana. So, if we are doing strengthening exercises, training, so how do we know if it is safe to proceed to heavy weights?
Okay. In physiotherapy practice, we do have a specific method how to increase the loads, the resistance, and the weight. Okay, we call it repetitive maximum. Okay, there is one repetitive maximum, and there is 10 repetitive maximum. Okay, but most of the time we use 1 RM, one repetitive maximum. Okay, in one repetitive maximum, what we do is, okay, we try to lift the maximum weight that we think we can lift. For example, easy example, dumbbell lifting. I think, for example, I give my example. I think I can lift 5 kilos dumbbell. Okay, so I try to lift up the dumbbell 5 kilos. Okay, so I found out that so easy 5 kilos. Then um, just lift up the 5 kilo dumbbell one times. Okay, if have no problems with the weight, increase the weight gradually, okay, to 6 kilo or maybe 7 kilos. And then at certain point, sure, you will find the weight that you find hard to lift. Okay. So meaning that the hard weight tu is not the safe weights lah for the exercises. Okay. So for example, I'll give my example. Just now 5 kilos, then I increase it 7, 8, and then 9. Okay, 9 I feel quite hard to lift the dumbbell. 9 kilo dumbbell is quite hard for me to lift. Okay, so meaning that the 8 kilos dumbbell is the safest weight for exercises. Okay, So now we know the one repetitions is 8 kilos. So for exercises, we didn't use the 8 kilos. Okay, okay. We only use 70% to 80% of the maximum weight. Okay, so meaning that 80% or 70% from the 8 kilos dumbbell. So probably maybe 6 to 7 kilos of dumbbell. So because of we want to do some repetitions, right? That's why we reduce the percentage from the maximum weight. That is one repetitions lah. But for for non-physios, okay, the easiest way to determine the safe weight is if you can do or if you can lift the weights without any uncomfortable sensations. Yes, it is safe for you to proceed with the weights or loads. But
Okay.
you have to try few repetitions lah with the weights.
Okay, thank you, Dr. Sawana, for the explanation. So, next question is for Miss Cindy. I found my knee knock to each other sometimes while jogging. Is it normal?
Okay, it is definitely not normal. Okay, because usually when your knee knocks to each other, that means you're having that kind of valgus dynamic movement. Okay, it is not static yet because you said sometimes. So it is definitely your knees knock during dynamic movement. Um, Usually when your knees knock, you have to look at the upper joint of the knee because knees knock actually indicates that your knee is not stable. Okay, to control the knee or to provide stability for the knee, you have to look at the hip. Okay, why? Because for example, the hip muscles like gluteus medius is actually controls the knee where it will provide external rotation and also will provide abduction force to the knee. So if your knees keep knocking into each other, you have to look at the outer area to see whether it is lacking or not. So what you can do is you can assess yourself by doing maybe for example, because we cannot say that, oh, if you can do 10 times you're strong, you can do 20 times you're strong. We don't have like outcome measures to say that how strong is strong, how weak is weak, correct? Not. So what you do is actually you compare your right and left. Okay, so when you compare your right and left, you can maybe do some, those side straight leg raise to see whether your gluteus medius are having the same capabilities or not. I think you should work on your hip if your knees are knocking to each other because hip is the main part that controls the stability of the knee. I think you should really focus on the hip, not only the knee but also the hip.
All right, thank you, Miss Cindy. But for this question, is it related with our body weight also?
So body weight, because body weight might I'm not very sure whether body weight really plays an effect on knee knocks or not because you see you're talking about sometimes. Your body weight is not changing all the time. You're talking about sometimes. So I think you have to look on the muscle strength and also flexibility weight. But if you're talking about all the time, your knees are knocked in certain position, then maybe you can look at the weight. And also I can say that some larger size people they might not have knee pain and some very skinny people they have a lot of knee pain. So I think the most important thing that we have to focus is whether your knees are able to take up the pressure or not. Some people they are slightly bigger. Okay, for example, some body weight lifter they are very big but they don't really have knee pain. Why? Because their knee is actually very strong to take up their body weight. Some skinny people they're very skinny but their knee is constantly having pain. So you know that their knees are not strong enough to take up their small body weight. So I think you have to always go down to whether you are able to take up the weight or not.
I see. Thank you, Miss Cindy, for the explanation. So next, the question is for Dr. Sawana. So is it true that cycling will build up our gluteus maximus muscle because some of the ladies prefer not to do these exercises due to this statement?
Okay. Gluteus maximus muscles over the buttocks, kan? Alright, so when you look at the cycling activities, kan, most of the time it requires your thigh and lower leg muscles. Am I right? But there is certain circumstances whereby other muscles also need to be worked. Okay, for example, climbing with bicycle kan, bila you kayu bicycle naik bukit, that one maybe you need to use your muscles over the buttock region. But most of the time when cycling, the muscles involved over the thigh and lower leg muscles. So the probability to make the buttock muscles bigger with cycling is less lah. Okay, so the chances is less. Okay, ataupun very very minimal. Okay, because cycling exercise is aerobic exercise or endurance exercise. Okay, it is not strengthening exercise. Okay, cycling exercise is aerobic exercises, endurance exercises. So basically, it will burn your fats out the body now, all over the body. Okay, it's not just burn the fat of the specific region. No. Okay, cycling will burn fats throughout the body. Okay, so actually it's good. It will reduce your body fat, especially over the lower bodies, including the buttocks, lower legs, and thigh. Okay. Okay, but there is a possibility where cycling exercise will firm up the buttock muscles. Difference firm up dengan make it bigger, different things. Firm up tu dia akan shapes lah the buttock muscles accordingly. Alright.
So is it same also with our thigh muscle, Doctor?
Thigh muscles, yeah, thigh muscle can be bigger because of cycling lah. But it's not, for me it's not. Cycling exercise will kalau besar pun is not very significant. Okay, because again it is endurance exercise or aerobic exercise. It burn fat. Tapi dia akan shapes you punya muscle. Dia akan firm up your lower muscles around the lower limbs. Yes, you firm up muscle over the lower limb.
Alright, thank you, Doctor. But how about people say that you have to do cycling in order to reduce your thigh size. So what do you think about this?
Come again? Do cycling to reduce time.
Thigh size of our thigh.
That one possible because again, the fat is lost with the cycling exercises because you know aerobic exercise required fat as the source of energy. So when burn fat, definitely your thigh will be smaller after the exercise, but not immediately lah. It takes time. Okay, it's not smaller lah. Maybe because of the fat has reduced. So that's why the thigh looks smaller. Other than that, when your muscles around the thigh is firm up, yes, it will look a little bit slim ataupun small. It's not small, it's slim.
Alright, thank you, Dr. Sawana. So we will move to our next question for Miss Yini. So sometimes when I am running, I feel itchy at the parts of my lower limbs. What is exact reason behind that?
Okay, so when you're running, you're actually improving the blood flow. Okay, blood flow. So when you're improving the blood flow, blood and oxygen rush through the capillaries and all the arteries. So it actually stimulates all the nerve cells, and somehow our brain actually interprets it as itchiness. Okay, because it stimulates your nerve cells. So usually, how to reduce the itchiness at your leg? Because sometimes when, for example, you didn't do exercises for a long time, and then when you start to run or start to do any jumping, you'll feel that kind of sensation. So how to reduce or totally eliminate this kind of itchiness is you have to do more often, because somehow if you do more often of your exercises, you actually reduce that itchiness in your body. Because last time when I started exercises, it was so itchy that I scratched. And I find out that after 1 or 2 weeks, when I'm more consistent, the blood flow that rush through the arteries and capillaries is nothing new to the brain because you have stopped exercising for so long. So somehow your brain interprets it as itchiness. If you keep doing it, actually your brain gets used to it and it's not some strange sensation already. I think
I
that
see.
is
Thank you, Miss Cindy. So, actually, this condition is normal it to happen.
it is normal, it is harmless, definitely harmless, because all these things will reduce or totally gone once you are more consistent. We're talking about consistency. When you're more consistent in doing it, your brain actually adapts to it. Same as exercises. If you are very consistent doing it, you're going to see performance, you're going to see improvement. If you run and then you stop for 3 months, you start running back, of course it's something new to your brain to adapt. I think it's something that normal and harmless, totally harmless.
I see. Thank you, Miss Cindy. So, our next question is for Dr. Salwana. So, what is the best or correct way to breathe when doing physical activity like hiking or running? Do you have any suggestion for this question?
Okay, breathing correct way. When doing physical activity like hiking, running. Okay, so hiking and running, it is running especially high intensity exercise. Yeah. So for high intensity exercise, as you run, okay, the intensity will increase. Okay, so for me, it's okay to breathe through both mouth and nose. Okay, because why? Because breathing through mouth and nose will allow us to take oxygen maximally, and then we can expel the carbon dioxide quickly. Okay. Um, as I mentioned, as the intensity of the running increase, it's quite hard actually for us to just breathe through the nose. Okay. That's why we most of the time we will breathe through nose and mouth when running. Okay. But you can get enough oxygen when running if you just breathing through nose. Um, that's fine. Okay. Because that's good. Okay. Because breathing through nose, the air is filtered and warm. Okay. But um, actually, there are a few tips lah, available in the internet how to breathe using abdominal muscles when running. But because of I never tried all the tips, so I have no experience. Okay, so I cannot share how to breathe with abdominal muscles or diaphragmatic muscles when running. Okay, but maybe some of us here have this experience. I mean, experience breathing with diaphragmatic breathing, abdominal breathing when running. Maybe they can share with us. But for me, it's okay if you want to breathe through nose and mouth at the same time when running.
Okay, all right. Thank you, Dr. Wana. So we move to our last question for this team. So for Miss Cindy, can you answer this question? What is the best exercise for someone who had a knee injury since the knee is not as stable as it used to be?
Okay, so I think it is quite this question is quite subjective because I've never seen how to say I haven't assessed this problem, and it is not wise for any physio to give out any best exercises for people who had knee injury. Okay, because we haven't seen the case. But what I can suggest is when you have a knee injury, you must always look into overall. Okay, for example, strength, flexibility, and stability. Okay, you must always have these three elements to balance out everything for the knee, because for you to have a good joint or good movement, these three plays a very big role. You cannot always stretch but you didn't improve the strength and stability. You cannot always strengthen but you don't improve the flexibility and stability. So I think after assessment, you can actually provide, because we are talking about gradually introduce exercise for people, you must always introduce gradually so that they are not in a shock to take all the exercises. You can actually proceed with some non-body weight exercises first. For example, if you have a very serious knee injury, you can do some weight exercises. You can improve even your hip okay, on the bed. For example, you can do some single leg bridging exercises. I can do, or even breathing exercises to improve the heat. And for me, maybe some SRR, SQE, that's the basic ones. Okay, once they are better, where when I say better, is we are not focusing on the time frame. We are always talking about dia punya response towards the pain. Like I said just now, when they are getting better, we can actually try to introduce some body weight exercises with. We shouldn't move straight away to weights and stuff like that. We introduce some body weight exercises, for example, more functional. Okay. What I can give idea is because I'm treating a lot of runners. Okay. Some functional exercises always focus on single leg strength training. Okay, because when they are running at, they are landing one leg at a time. They don't do this when they run. You see, they don't hop with two legs when they run. So their exercises that I will provide them is actually single leg strength training. For example, single leg sit to stand, single leg reverse deadlift, to actually bring them to be more practical for their running. When they are running, you cannot give them exercises for tennis or for badminton. It is not practical for running. So we give them exercises based on their sports activities. For example, kalau they main tennis and they have injuries, we focus a lot on agility. Okay, a lot of balancing exercises, or even we can improve their punya hip and ankle. So I think these are the best exercises to give people who have knee injury. Always focus on their goal and also their response towards your treatment. Because there is no standard rule. Macam kalau you have knee injury, there is no standard rule that say that, okay, the first thing is SQE, the second thing is SRR. No. You must always respond to their issues. I think this is the best program for them. Yeah.
Okay, I see. Thank you, Ms. Yini and Dr. Sawana for a great sharing. Now we will move to our next session, which is Q&A from the participants. So since that we have received a lot of questions in the chat box, so I will pick a few questions from it. So for the first question is from Brother Tariq. He said that, sorry, this may be late to us regarding the first question. Sendi and urat masuk angin by Dr. Sawana said it is impossible for angin to even penetrate. But what actually happened when massage is like, we tend to sendawa as like angin has moved up. Is there any specific explanation for that, Doctor?
Okay, Brother Tariq, may I know siapa yang tahu people are being massage ataupun the masawa?
Actually both.
Both, yeah? Okay, I go for the masseur first, okay? For masseur, when we massage, when the masseur massage, okay, they use a lot their upper body parts, okay, the limbs and the body, the abdominal muscles, okay. So when they massage, all the muscles are working, okay. So when the muscles are contracted, of course, all the gas, all the air from the stomach and intestine will be mobilized, okay, because there is some activity around the upper body parts, especially around the abdominal. Okay, that's why ada setengah apa tu nama dia, pengurut, dia akan sendawa lah, okay, because of their own angin. Okay, bukan pesakit dia, bukan pesakit angin, bukan angin daripada pesakit pergi masuk ke badan dia, lepas tu dia lepaskan angin tu, bukan. Okay, it is because of angin from his stomach or intestine. Okay, untuk yang diurut pula kenapa sendawa, explanation almost the same because of when the masseur massage the body, okay, they mobilize all the muscles. Okay, sebab tu kalau diurut, orang yang diurut tu pun akan sendawa juga because of that, because of the the masseur mobilize the muscles around the abdominal region. Itu secara general explanations lah. Of course, scientific explanation at the moment I tak jumpa lagi lah. Tapi setakat yang secara general begitulah explanationnya.
Alright, thank you Dr. Sawana for the explanation. So Brother Tariq, is it clear to you? Okay, it's okay. Never mind. So we proceed with the next question. From the user physiotherapy 191. Uh, some people might have the thought to be active, but they don't know the first step on how to be active, like how to increase heart rate, increase strength, how to target our power. Any comment about this? Miss Dini or Dr. Salona can answer this.
I think you should consult people with very good background on how to guide you, because if you just follow YouTube ataupun Google, there are a lot of exercises, banyak sangat, but like I said, you must always get to your goal and, for example, what kind of disabilities that you have. So I think the first step is always to consult people with good background, sports therapists or any physio, even physio. But for example, macam fitness trainer, I have a thought that they might not really understand the anatomy and physiological of us. So I think it's better to consult physio, because at least we have some education on more aspects. Fitness trainer, yes, they have some anatomy physiological, tapi dia tak in depth. So I think consulting physio ataupun sports therapist will be better. What do you think, doctor, about this question?
Yeah, I
Do
agree with you.
you,
um if you want to increase your, is that called, increase strength, how to target our power and comment. Okay, you can go to proper persons to get advice, or else you can do exercises as long as you are comfortable with the intensity of the exercises. Okay, about the heart rate. Okay, you shouldn't, when you do exercises, you shouldn't go beyond your maximum heart rate. Okay, it's very easy to calculate the maximum heart rate for exercises. Okay, if not mistaken, 220 minus your age, that is your maximum heart rate. So when you do exercise, do not beyond that rate. For example, your age 20, so 220, you check back, okay? If not mistaken, 220 minus your age 20, so 200 is your maximum heart rate. So when you do exercises, it is not advisable to go beyond the 200. That is your maximum heart rate. Okay, so for exercises, you can the heart rate can go up to 80%. The highest one 90%, if not mistaken, but usually 70 to 80% from the maximum heart rate to get the optimum benefit of the exercises. Okay.
Okay, thank you, Cindy and Dr. Sawana, for the explanation. So next question is from Sister Zulfa Abani. She asks, is it true not running on track, example jalan or on tar, can affect our joint?
Okay, for running, okay, for me, the most important thing is you have to make sure that you run on the flat surface. Okay, why? Because to prevent injury. Okay, so it doesn't matter kalau you nak run on jalan tar ke, tak jalan tar ke, as long as it is flat and it is safe. Okay, jalan tar pun is not recommended kalau yang tepi jalan yang very busy jalan tu. It's recommended for you to run on the busy road. Okay, because it's not safe. Okay, affect our joint. Yes. Why? Because if you run on uneven surface, okay, you will be exposed to injury. Okay, if the ankle sprain, knee injury, ligament sprain, muscle strain, and other injuries. So that is the reason why you have to run on the safe surface.
Alright, thank you, Doctor. Next question from Brad Hami. Miss Cindy, can you please answer the question? Which is, there are a lot of videos on how to lose weight, but mostly involve jumping action. But is it true that we shouldn't do exercise that put burden or weight on our body, like jumping, we are overweight?
Okay. of course when we are, macam I cakap tadi, jumping exercises and all the exercises dia tak bersalah, okay? You can do those exercises to improve your performance, but before you do any exercises, you have to see whether your legs are suitable or not. Suitable or not to perform those jumping exercise. So what I suggest is you know the keyword is gradually. Okay, you gradually introduce intensity to your exercises. So for example, kalau you are overweight, what you do is you can do some very light intensity exercises such as brisk walking, or maybe some, nowadays they have a lot of step exercises. You can do some very simple stepping exercise, even Zumba to reduce your body weight first. We're talking about anaerobic and anaerobic kind of movement. So you reduce your weight first, then only you gradually improve to maybe some body weight exercises, and at the end only you introduce jumping. Jumping is not wrong, but how you introduce jumping to your joint is actually making a lot of difference, because when you are slightly overweight or when you're not strong, if you do this jumping exercise, it's definitely going to cause a lot of hurt to your joint. But if you are gradually introduce things to them, when they are smarter to adapt jumping, when they're stronger to adapt, I think it won't cause harm to your joint. We can do, but slowly and gradually introduce them.
So, okay, thank you, Miss Cindy. So, is it that we need to focus in reducing our weight and gradually include the jumping exercises?
Yes, we reduce our weight first and also introduce some strength. Macam saya cakap tadi, your lutut has to be strong enough to do those activities. So you can actually do together. Maybe one day you do a bit of brisk walking to burn some calories, burn some fats, and then the next day you can do some very mild, maybe some mild strength training. And then when you are slightly stronger, you can do some very light hopping first. You don't do jumping, you see. Macam I cakap gradually introduce is before jumping, you can do some light hopping, some light hopping and then light skipping. Then only you introduce jumping, because jumping is very high intensity actually. So introduce slowly. You climb the ladder slowly. Then you're gonna reach the jumping action soon.
All right, thank you, Miss Yeni, for the explanation. So, next question is from Sister Siti Aiman Shakira. How to make members listen to your advice as a healthcare practitioner? So, what do you think about this question? That is
Okay, first listen to your advice as a healthcare practitioner. Yeah. How to be honest, it's quite hard actually. Because why? Because family members. That's why, if I'm not mistaken, kan, there is kalau tak silap saya lah, dia tak boleh buat specific process their family members. Because of these things lah, if I'm not mistaken, I have heard about this long time ago, but nowadays I tak sure lah mesti diterapkan ataupun tidak. Okay, but physiotherapy, if you want to treat your family members, it should be no problems lah. Okay, but to listen to your advice, actually it's up to them. Okay, for me, it's up to them. You as a physio or healthcare practitioner, you just do, okay, advise them and then help them. Okay, at least you have done your part. Okay, whether to listen or not is up to them. Whether you have to do your advice, you have to follow your advice, is up to them. The important thing, you have done your part.
okay. So next question for Dr. Sawana also. From Brother Ahmad Al Miaraj. From your experience, how to effectively ensure that the person you treat is going to exercise to do the exercise back home apart from the session in the center or hospital?
Okay, so how to make sure a patient do exercises at home, right? Okay, to make sure atau to ensure patient do exercise, really it's quite impossible actually. But we can encourage them, okay, or we can motivate them to do the exercise by providing pamphlet, okay, rather than just makcik buat ni kat rumah je, ni buat ni kali ni. And then just verbally instruct them to do the exercise. You can provide them with a written instruction. Okay, like booklet, leaflet, Other than that, you also can use a diary ataupun provide your patient with a small exercise diary so that they can record their exercise activities. So for the next follow up, you can check the diary or exercise log also can. So you provide them with the diary or log. You ask them to fill up the diary when they do exercises. Okay, what else? Other than that, we also can send them something like reminder through emails or WhatsApp ataupun apa-apa medium. Send a simple reminder ataupun like quotation about exercise ke. Okay, so maybe when they receive that, oh, then that way they need to do exercises. Okay, what else? Okay, for research, okay, if you do research, how to make sure your patient do exercises, I think there is a device lah. Okay, we call it pedometer, something like that lah. That one also can be used. But for physiotherapy intervention, the common practice, biasanya kita pakai diary, reminder, provide them with the pamphlet of. But how to really make sure they do at home? One quite challenging. Maybe you can ask the relative whether patient do the exercise or not at home, something like that.
All right, thank you, Dr. Sawana, for the explanation. So next question from Brother Naim. This question, I think, Miss Ini, can you answer or suggest what the best time to exercise? Is it morning, evening, or night? What your opinion?
I think my opinion is anytime whenever you are free, because when you're not free, when you're rushing through the exercises, I think it's not going to benefit you. So either it is morning or night, preferably because we're living in Malaysia, so dia punya haba is quite different. If you're undergoing HIIT training on purpose, because some exercises you need some HIIT training. Macam kalau you buat long distance running, you need some HIIT training. So that is okay as long as you ada sufficient hydration. So it must always come back to you, your body, whether you can adapt or not, whether your timing, your schedule is okay, and also whether your body can take up to the humidity or not. Usually I prefer morning because morning it is less humid, okay, especially I think after subuh is definitely the best time because the weather is still very cooling. Usually at night or evening, the heat comes up from the road and it's very, very humid. So it will actually increase your body, your heart rate to maximum. Like Doctor said just now, we cannot exceed certain heart rate. So I think morning would be the best time for me. Okay, unless you don't have time, it is totally fine to do at night, but you have to improve your body hydration first.
I see. Thank you, Miss Ini. So next question is from Ibrahim Adil Ali Ahmed. He asked, how can we encounter people who believe that the workout and exercise is meant for heavy weight or obese people only for reducing weight purpose, but not for normal or underweight people? So can you answer this question, Miss Ini?
Okay, actually, like Doctor said, we have to do our best to explain to them what are the things that they should do and they should not do. What they want after that, what they want to do is definitely up to them. So how do we tell? Usually, how do I tell my patient? Because some people they will say that, oh, because some exercises you want me to improve my muscle bulk. I don't want muscle bulk. I just want to be. Okay, some people say that. So what I'll tell them is, yes, for you to be fit, you must have some basic strength or basic capability for you to take up that kind of activity. For example, some people say, okay, bila I lari, I akan jadi kuat. Sometimes bila you lari, you tak jadi kuat. You akan jadi, actually, you have more injuries. Running is an activity, you see. So for you to be able to compensate the kind of activity, you must have basic strength. And when we're talking about basic strength, it's definitely that is practical to running. So from there, I would advise them to, actually improve some of your basic strength. I know you're not trying to improve your bulk. I know you're not trying to losing your weight. For you to be able to do those activities, you have some basic strength. Kalau tak, you will punch it very long. You will sooner or later you will injure yourself. This is what I will tell them.
All right. Thank you, Miss Cindy. Thank you, Dr. Wana and Miss Cindy, for the interesting information. I hope that all the participants could gain new from this session. Now, it seems that we are at the end of the program. But before we proceed with a photography session, I would like to ask all the participants to switch on your camera.